Oh, nice. Yeah. All right. Brian, are you good?
Oh, these chairs are nice.
Okay. Are you good? Okay. All right. Well, welcome. I'm Taylor Thompson, and this is Mickey. And we're going to introduce our Hoskinson Direct Care program. The goal of this program is to allow people to access healthcare in an easier way. So it's not health insurance, but it's a model where you, like a subscription model, where you can come in and get treated with pretty much any of our services in-house, and your subscription pays for that. So the nice part is you can kind of be proactive about your health rather than worrying about what the cost is, waiting for that type of stuff. So that's kind of the idea with this program, is we're trying to find a new way to deliver good healthcare. So I'll pass it off to Mickey. She's the expert. And yeah.
It's green. All right. Like he said, my name is Mickey Pierce. I'm the program administrator for Hoskinson Direct Care. So we'll just go over what the program includes. We'll give you a chance to ask some questions, and then if you would like, we'll give you a tour after we're finished. So let's see. So first, about Hoskinson Health and Wellness Clinic. It is founded by the Hoskinson family to deliver high-quality healthcare with a focus on research and advanced technology. So we offer comprehensive, full-spectrum care, from primary care to many specialties that we have. And for those listening online, we do have a clinic guide that we'll be referencing, and there is a clinic guide at the back. You can check through that and see all of the specialties that we have, as well as all of our providers. One thing that is really unique is we do have on-site diagnostics. So we have a lab as well as radiology services, and then we'll talk about why that is important for your membership. So like Taylor mentioned, it is a healthcare membership that focuses on prevention and wellness. We want you to utilize your membership so you aren't getting to the point where you're very ill and are having to see someone at the hospital, or being hospitalized or having surgeries. It provides comprehensive access for your everyday healthcare needs. So that $250 monthly membership that you pay to the clinic covers all of your visits with our providers, and the visits would be tailored to your health needs. So if you need to see a cardiologist, that is included in your monthly membership fee. And for who it is specifically aimed for are those who are not covered by Medicare or Medicaid. So if you're not enrolled in those programs, then you can certainly sign up. And that is only because the Center for Medicare Services limits our ability to provide a membership as well as those folks to be covered under the Medicare program. And we stress this a lot just because we don't want people to not understand what it is. It is not health insurance by any means. It's a relationship directly between you and Hoskinson Health and Wellness Clinic. And so what is included? So like I mentioned, visits with our providers and specialists. So that's any provider that's here at our clinic is included. We like you to reach out if you have something urgent. We would like you to reach out so that you can take advantage of same day or next day appointments. It might not always be the provider that you normally see, but we'll do our absolute best to get you in as quickly as possible. It also covers chronic disease management, things like hypertension, diabetes, any kind of chronic condition that needs management is also included in the program. Basic procedures are included, so things like stitches. What are some other examples of procedures that are included?
Anything that we can do in-house. So like nail removal. Sometimes people need help clipping nails, that type of stuff. Yeah, stitches removal. So if it can be done here, then we can essentially do it. So there's a lot of procedures. But
Yeah, so when we say procedures, anything that can be done here, so things like surgeries that require general anesthesia or a surgical suite would not be included in the membership. Any in-house labs that you need, whether it's for wellness or diagnostic, is included in your monthly membership. So you can just come here. If your doctor orders those labs for you, you don't have to worry about getting a separate bill from like Quest Diagnostics or anything like that. That monthly membership fee will cover it. And as well as imaging. So this is really important. If you do have an accident, say, and our urgent care is open and we need to take an x-ray, we would include that in your membership. For women's health, mammograms are included in your monthly membership. MRIs and CT scans that are medically necessary are also included. So if we need to take imaging to diagnose and help you with a condition, then that will be covered as part of your monthly membership. And we have this really cool feature where you can message your provider through what's called the Athena patient app. And when I was talking about making sure you're reaching out, there's a lot of times where you can send a message to your provider and you don't even need to come in for a visit. Insurance requires our providers to see a patient before they can do anything most of the time. With this membership, we can bypass that and make it more convenient for you. So whether it's a phone call or a message through the Athena patient app, we can communicate with our providers quickly and get you, the service that you need. And so let's talk about what is not included. Pharmacy items. So anything that comes from our pharmacy is not covered under the membership. So prescription medications, durable medical equipment, vaccinations, and infusions are not covered. If you ever needed any of those services and you wanted to know ahead of time what you would be paying, you could contact me and I could get you an estimate of what that would be. And we do have many prescription drugs that are between $4 and $10. So we can, usually there's a lot there that you can choose from that is very affordable. And we do have some cash pay services that are not included in the membership. Neither insurance will cover it. So one of those is the amortal chamber, which helps with, Taylor can tell us more about what.
Yeah, it's like a red light therapy chamber. So red light is going to help your cells produce energy. So that can help in a few ways. You're not ever going to be able to be prescribed red light therapy typically from a doctor, but this is kind of like a relaxation bed, let's say. It's red light therapy, it's molecular hydrogen, it's PEMF waves, and then it's kind of like breathing exercises that walks you through. So, and then it's kind of like with our hyperbaric oxygen as well. For a lot of these services, they're more cash-based services. And so those wouldn't be included, but anything else with your doctor or imaging labs, those would be. So, and then another one that's included is this TMS machine. I don't know if you guys are familiar with this. This is kind of a system that helps with depression. So people treated with this actually don't, I think like 30% of them never need medication again. And usually this is a cash pay service, but we've included this in the membership, just like our Big Vectra scanner, which is a mole mapping device that we use with the dermatologist to track how your moles are changing across time. And we'll show you that. I think Kelly shows them that on the tour. You'll see that on the tour. That's also included in the membership. So by default, most of our cash services are not included, but then some of the fancier stuff we have included. So yeah.
Yes. And while we're speaking about TMS, I just want to highlight that mental health care is included in the monthly membership. That is both therapy as well as psychiatric care. So if it were ever, recommended that TMS be utilized for your treatment, that would be included in your monthly membership. And so any treatment that's performed outside of our physical clinics here would not be included. So if you were to visit any other facility that is not affiliated with Hoskinson Health and Wellness Clinic, that will not be covered under your monthly membership. And so some of the reasons why people are choosing Hoskinson Direct Care is, one, rising healthcare costs. I'm sure you guys have all seen it in the news. It's skyrocketing, and Wyoming is actually a state that is being most deeply affected by those changes in the healthcare marketplace. And it is a predictable cost that you can plan for every month. You don't have to wonder, am I going to get a separate bill from, the imaging team and the lab? So in addition to just an easier experience, you can plan on what you're going to pay each month. So it also has a stronger focus on the relationship with your provider. We want your provider to be someone that you can trust and is going to be there for you. And like we mentioned, there is a focus on preventive health and wellness. All of our services that are not cash pay from our lifestyle center are included. And Taylor here is our director of lifestyle medicine. As an exercise physiologist, he can tell you more about some of those services that are included.
So yeah, in the Lifestyle Center, we have a registered dietitian, so she can help you with the diet. She's a diabetes educator as well, so patients with diabetes, this would be a good program for. We also have a sleep medicine provider, so sleep studies are included in that. We have pulmonary function testing for lung issues. We have cardiac testing for heart issues. We have an exercise program where we have a personal trainer, and she coaches people and sees them every day. We have a little group where people can join. And then we also have physical therapy, because the goal is to keep people healthy and moving and sleeping well and eating well, because if we can do that, then we can treat you better, your risk is lower. And so what this program is really good at is aligning the incentives of healthcare. So with health insurance and with a clinic, right, the sicker you are, a lot of times the more money we make, because then insurance is going to pay us a lot of money to treat you, the worse off you get, right? So like a good example is the weight loss drugs, the GLP-1s, Manjaro and those. You can only get those, well, it's changing a little bit, but usually you can only get those if you already have diabetes. But if you have pre-diabetes and it could help you not get diabetes, we can't get you that, and it's not going to be covered. So of course, this program doesn't cover those drugs either, but the idea is we want to stop you from getting the disease. So the healthier we keep you, the less resources you use. And so we want to use resources early to help you stay healthy is kind of the goal. So it aligns the incentives so that the healthier we keep you, the better it is for everybody.
Exactly. And also cutting edge technology. So we've talked about a little bit about TMS. Most of the time, TMS costs between $13,000 to $15,000 for a successful treatment. That's included in your membership. That is cutting edge technology. A lot of folks in Wyoming do not have access to that kind of equipment. Like the Vectra machine, which is that mole scanner, is very advanced. You don't have to go through the embarrassment of having someone physically check every mole on you every year or as required. So those are some other great tools. So let's talk about the actual membership terms. So it's $250 per person per month. The membership fee is due on the first of the month. It does renew monthly, and by default, it's a 12-month term. But if you want to cancel, if you are finding you're healthy and you aren't needing the membership as much, then you can cancel. You just have to provide a 30-day written notice. And right now, it's just $250 per person, no matter age. So if you have kids or young adults, it is still that $250, because all of those services that us as adults can benefit from, our, younger kids and pediatrics can also benefit from. And it's great for individuals and families. We've talked about folks with chronic conditions, and it's especially good for that gap that's created for folks who maybe are underinsured or uninsured. Maybe you can't get on a certain type of health insurance because you make too much money, or those types of reasons are a good reason to sign up for the membership. And also, it's a great option for employers who are seeking to offer an alternative, affordable health benefit to their employees. Okay, so we've kind of covered the majority of the program. What questions do you guys have for us? Anything that maybe you're concerned about, or wondering if it would be covered? I know we talked a little bit about ophthalmology is included, that while we don't offer like contacts and glasses here, your annual eye exam is included. So we have an outstanding ophthalmologist, Dr. Navan, who can see you as part of your monthly membership, as well as our audiologist. There's a lot of great specialists here who can take care of your whole health instead of going and experiencing that fragmented care.
You basically want your customers to be proactive with their health rather than reactive.
Exactly. Yes. We want to take a proactive approach and make sure, and as well as, so we've talked a lot about the health and like what you can do to see a provider. But another added benefit of this program is we offer exceptional customer service for our members. So if you ever have an issue, you don't have to be bounced around 10 to 15 people to try to figure it out. You can just call me, the program manager, and we'll make sure that all of your issues are handled promptly and done well so that you're feeling that value from your membership. So if we don't have any additional questions, let's talk about enrollment. So if anyone decides to enroll, if you're here in the clinic, you could talk to any of our team members, and what they'll do is send your information over to me, and I will find a time that we can connect and we can get you enrolled. You can also email hdc@hoskinsonhealth.com, and we'll follow up with you there. Also, our phone number, you can call that phone number. And if you want to actually go ahead and enroll, if you know that this is something you want to do, you can scan that QR code on the screen and it'll take you directly to our enrollment page. The next enrollment date is January 1st. Payment is not due until January 1st. But let's see. So if we don't have any more questions, we can go ahead and take a tour, or there's refreshments available for you guys. Feel free. Any other questions that I can answer?
Before you're done, can you go back to that QR code? I'm trying to get my camera to.
Oh yeah.
I might have to walk up there.
You might need to hide, right? You hide that?
Oh,
I
right.
can have it.
Yeah,
Oh,
that might be fine.
thank you.
There you go.
There we go.
Oh, now it's right.
Yeah, that was the problem.
Thank you.
Yes, and I do have, there is a handout that you guys can take with you that kind of just goes over what we talked about. And if you have any questions, you can call that phone number. And then my business cards are on the table. So if you know anyone in the community that's talked about how they're really needing health care or they're needing help, feel free to give them my card. We always want to make sure that folks have access to some form of health coverage. So feel free. And does anyone want to take a tour?
Yeah, I sure will.
Okay. All right. Well, thank you for the folks who joined us online.